So we offer through our Vita support program, we offer bridge program for eligible patients. We also offer copay assistance for commercially insured patients, reimbursement research support by the Vita's experienced group of access specialists, and also continuous clinical product support by Vita's experienced group of clinical education managers. And when necessary, specifically patient nutrition program, we offer support through our clinical education managers who are all registered dietitians who are very experienced and trained in the metabolic inherited disease diets. So what happens to a Harlequin prescription once it is referred to Vita, and how does Vita support the patient and provider? The support that we offer really is from enrollment form receipt all the way through specialty pharmacy triage and beyond. So that enrollment form comes to us from a provider. So that could be a PCP, a geneticist, or another provider that is prescribing Harlequin for AKU. That enrollment form is received by our Vita hub team, and the access specialist intakes that form and triggers a welcome call to the clinical education manager team. And during that welcome call, that clinical education manager will speak with the patient to identify any barriers that they may face to adherence or insurance barriers that they may have faced previously with nitisinone. And on the back end, while that welcome call is happening, that access specialist is running what we call a benefit investigation. So speaking with the insurance plan, finding out what is necessary for Harlequin to be prescribed and covered by insurance, and packaging all of that information up into what we call a benefits summary or summary of benefits, which is then sent back to that prescribing provider's office so that they are aware of what to submit to insurance, to this patient's specific insurance, for Harlequin coverage. We also offer prior authorization and appeal support. So while we cannot submit the prior authorization and appeal ourselves, we are available to provide support, including letters of medical necessity templates, white papers with literature, anything that might be necessary for appeal support, because we definitely don't want providers working in a silo and submitting things and not having resources that might already be invented that we can provide them with. We also offer provider field reimbursement support. And then for those who are eligible with commercial insurance, copay assistance and reimbursement. So once insurance has approved Harlequin, we are able to determine if they're eligible for copay assistance, if they have commercial insurance. And at that point, we route a patient and their prescription to a specialty pharmacy, which then dispenses that medication on a regular basis with insurance. And at that point, the patient is now at the specialty pharmacy. We've supported the provider in getting the patient to that point with insurance, but it doesn't stop there. Vita support goes beyond that. So we offer continuous clinical support. So if diet treatment is implemented or necessary to be implemented, we've got our clinical education manager, dietitian team that's able to support patients if that is a bridge they have to cross. And then eventually, when prior authorization renewal or recertification comes around, our access specialist team is there to assist with that whole process all over again. So the process is obviously there's a direct end to the Vita support program. But we offer continuous support after that patient is prescribed Harlequin.
Important safety information. Indications. Harlequin is indicated for the reduction of urine homogentisic acid, HGA, in adult patients with alkaptonuria, AKU. Important safety information. Do not prescribe Harlequin to patients allergic to nitisinone or any other contained ingredients. Warnings and precautions. Ocular symptoms and hyperkeratotic plaques due to elevated plasma tyrosine level. Ocular signs and symptoms including keratitis, corneal opacities, corneal irritation, corneal ulcers, conjunctivitis, eye pain, and photophobia have been reported in patients. Perform slit lamp examination prior to treatment and regularly thereafter. Re-examine patients if symptoms develop or tyrosine levels are greater than 500 micromoles per liter. Assess plasma tyrosine levels in patients with an abrupt change in neurological status. Perform a clinical laboratory assessment, including plasma tyrosine levels, in patients with an abrupt change in neurological status. Leukopenia and severe thrombocytopenia. In clinical trials, patients with hereditary tyrosinemia type 1, HT1, treated with another oral formulation of nitisinone and dietary restriction, developed reversible leukopenia, thrombocytopenia, or both. No patients developed infections or bleeding as a result of the episodes of leukopenia and thrombocytopenia. Monitor platelet and white blood cell counts during Harlequin therapy. Adverse reactions. The most common adverse reactions, greater than or equal to 1%, reported in patients with AKU taking nitisinone in clinical trials are elevated tyrosine levels, thrombocytopenia, and keratitis. Drug interactions. Nitisinone is a moderate CYP2C9 inhibitor and a weak CYP2E1 inducer. Potential clinical impact of Harlequin administration with CYP2C9 substrates. Reduce the dosage of the co-administered drugs metabolized by CYP2C9 by half. Additional dosage adjustments may be needed. Nitisinone is an inhibitor of OAT1/OAT3. Potential clinical impact of administration with OAT1/OAT3 substrates. Patients should be monitored for potential adverse reactions. Use in specific populations. Pregnancy. Limited available data with nitisinone use in pregnant women are not sufficient to determine a drug-associated risk of adverse developmental outcomes. The background risk of major birth defects and miscarriage for the indicated population is unknown. All pregnancies have a background risk of birth defect, loss, or other adverse outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered against the mother's clinical need for Harlequin, along with potential adverse effects on the breastfed infant from Harlequin or from the underlying maternal condition. Pediatric use. The safety and effectiveness of Harlequin have not been established in pediatric patients with AKU. Geriatric use. Insufficient data from clinical studies of Harlequin to determine if patients greater than or equal to 65 years of age respond differently. Elderly patients should be cautious reflecting any decreased hepatic, renal, or cardiac function, and of concomitant disease or other drug therapy. For more detailed information, please refer to the full prescribing information at harlequin.com/PI. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-855-831-5413 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.